Hi, I'm Keith Murphy. I'm currently the Executive Director for a healthcare organization in Boston, working on a strategy development and deployment process. I'm going to talk about work I did at a previous hospital I worked at, a large hospital in the Boston area, in our operating rooms. To give you a sense of the size of our operating rooms, we had over 40 operating rooms and with over billions of dollars of revenue each year from our surgical procedures. Surgical, typically in a hospital, the OR is the most profitable area in the hospital, which generates anywhere between 40 and 50% of the revenue for that hospital. I was approached by our senior leadership team from administration as well as from the operating room to help them work on the turnaround process between our surgical cases. The turnaround process is the time that one surgery ends and the next surgery begins in that same operating room. There's a lot of opportunity for process improvement. My team and I, utilizing lean methodologies, we're going to work on this project. We started dialoguing with the OR leadership team, and I was also encouraged by our senior leadership to explore new ways of doing process improvement. So we started exploring Scrum Agile methodology, did some research there, and then we partnered with the gentleman from Scrum Inc. to come on site and provide on-site support of us as we made these process improvement efforts, and to work with our OR teams and our OR staff to reduce the turnaround time.
Hello, I'm Kevin Ball with Scrum Inc. I'm a trainer, consultant, and coach for our organization. We were brought into a very large hospital in Boston to look at their operating room and their turnaround time. The turnaround time is what we talk about when we talk about wheels out to wheels in, when the patient is wheeled out of the operating room until a new patient is wheeled in. We worked with OR leadership to tackle this problem. What was really neat about this, leadership led the charge. The OR leadership put all the medical staff together in one room. It was about 100 people. And they say, hey, we're going to use this Scrum thing. We're going to do this experiment to see how we can reduce our turnaround times. So we did the experiment within one pod. One pod equals 3 operating rooms and 3 cross-functional teams. But we started with one section of the team. We started with the cleaning crew first, right? We encouraged that team to think about things, how they can reduce their cleaning time. So they were empowered to speak. They used courage to speak up, and they talked to each other in a really respectful way. And in fact, we even rolled in the infection control team as well to get advice on the suggestions they were making. So that was wave 1. Wave 2, we actually went into the operating rooms and scaled it and worked in the singular pod. One pod again equals 3 surgery rooms. So we worked with the cross-functional team. Pretty much the head surgeon was the product owner for this team. The nurse in charge served as a Scrum Master role, and the other team members, anesthesiologists, any medical staff, students who were in the room, and the cleaning crew as well. So before the case started, we had a conversation, pretty much like a daily Scrum. We talked about the things we were going to bring in and how we're going to set the room up. After the surgery, we reviewed some of the conversations we had and some of the suggestions we made and did a retrospective of how we can work better as a team. Next case comes in, we do the exact same thing. We huddle up, we bake in those suggestions, and in fact, one of the nurses in charge said, hey, instead of opening up all of the instruments, I'm gonna open up just what the doctor needs just to get the case in, because they had to call the patient from upstairs to downstairs. That also saved time. So all together with the cleaning crew having the courage to speak up and talk to all the medical staff in terms of suggestions on how to clean the room, the medical staff themselves, including the head surgeon, throwing out ideas how to make the case go a little bit faster as well. So historically, this particular hospital, a really large hospital, was experiencing about 1 hour and 15 minutes in turnaround times. Our goal was to get it under an hour, but we made it in 30 minutes. The fastest turnaround time in its history, 30 minutes, including cleaning time and drying time. So this drying time is really important to think about because there was chemicals that had to be wiped down and mopped up at the end of the surgery. So that included 10 minutes. So all together with the 10-minute drying time and cleaning time and the entire crew changing out the room, we did a record time in 30 minutes.
Hi, I'm Jeff Sutherland. I'm the co-creator of Scrum and the creator of Scrum at Scale and the founder of Scrum Inc. And I'm here to emphasize how important this effort in surgery is. I actually have 35 years in healthcare. I was a professor of radiology for over a decade at the University of Colorado School of Medicine. And as I came into the commercial sector implementing Scrum, I was often asked to help in healthcare institutions. I was CTO of 2 major healthcare companies. And in the early 2000s, the CEO of the University of Maryland Medical Center asked me to co-write a grant with him on the operating room of the future. So I spent some years in innovation in operating rooms. So when Keith came to me and said, hey, we want to do some process improvement in the operating room, will Scrum help? I immediately said yes, but I understood all the problems of getting people focused and moving in the right way. And what I wanted to see was a good implementation of Scrum at scale. And that means it starts with a leadership team that's going to prioritize this as a significant effort. In Scrum at Scale, we call that the Enterprise Meta Scrum team. This was the head of administration, the chair of surgery, Keith working with them to get this prioritized. And then we need a leadership team to help execute this. And this was Keith, the head of surgery, the head of anesthesiology, the head of nursing, and then we need teams really focused in a Scrum way. So the sprints were small, one case, and the product owner of that sprint is the surgeon, who's a working product owner, and the Scrum Master is the head nurse. So we get the Scrum structure set up in the right way, and then we can execute really well. Now, why is this important? 17% of the GDP of the United States is spent on healthcare, and a minimum of 25% of that is known to be waste. So there are huge amounts of money at stake. I knew from a grant research I'd done at University of Maryland that an operating room cost was about $12,000 an hour. So by cutting that down to 30 minutes, cutting a half an hour out of that turnaround time, that's about $6,000 times the number of surgeries times the number of operating rooms. And in this case, it adds up to about $1 million a day. And $1 million a day with 5 days of surgery every week is $260 million a year that goes straight to the bottom line of a hospital. Also, in this case, they were able to increase the number of surgeries by 20%. The half of the revenue of a hospital is related to surgery. This hospital had billions of dollars of revenue. For every $1 billion of revenue, they got about $100 million more through getting more surgeries done. So that's 260 million plus some hundreds of millions. We're probably looking at about a $500 million hit if we can scale this throughout the entire organization. So Scrum can be extremely effective at having major impacts on hospital systems in terms of improving revenue, reducing cost, and surprisingly, when you execute well, you actually reduce patient error, and you also increase the numbers of surgeries, so you're treating more people. So this is a really win-win for everyone, and we're really trying to do more work in healthcare.